Topic is the duodenum. So duodenum is the first part of the small intestine. So now we are going to discuss about the duodenum. So as I said, it is the first part of the duodenum and it is the most fixable part of the intestine. And mainly the common bile duct and the pancreatic duct just open into the second part of the duodenum and secretes its secretions into the duodenum, and all it involves in the digestion process. So it mainly involves in the digestion process. So these are the main function of the duodenum. Coming to the location of the duodenum. So first it is located above the umbilicus in the abdominal cavity. So first we have to speak about the abdominal region. So this duodenum is presented in the abdominal cavity just above the umbilicus. And coming to the vertebra, it lies opposite to the L1, L2 and L3. So here you can able to see the parts of the duodenum. So first part, second part, third part and the fourth part, and it lies opposite to the L1, L2 and L3. Okay, so first part is the superior part, second part is the descending part, third part is the horizontal part and fourth part is the ascending part. So this is the parts of the duodenum. So first part, which is superior, second part which is ascending down, and third part is the horizontal part and fourth part is the ascending part. Okay, so these are the four parts of the duodenum. Coming to the measurement, superior part is the 5 centimeter, descending part 7.5, horizontal 10 centimeter, ascending part is the 2.5 centimeter. So to remember it easily, just see first ascending part, which is the 2.5 centimeter. So 2.5 centimeter plus 2.5 centimeter is 5 centimeter, that is superior part. 5 centimeter plus 2.5 centimeter, that is 7 centimeter, that is descending part. And add 2.5 centimeter, that is horizontal part, that is 10 centimeter. So here 2.5, here 2.5. So from the ascending part, just add the 2.5, we will be getting as superior part plus 2.5 descending part plus 2.5 horizontal part. These are the measurements of the duodenum, different parts of the duodenum. Okay. So coming to the relations. First we have to speak about the peritoneal relations. So proximal, that is first 2.5 centimeter of the duodenum is intraperitoneal, that is presented inside the peritoneum, whereas remaining all the parts is the extraperitoneum, which is presented outside the peritoneum. Okay, so coming to the visceral relations, we have first part of the duodenum. In the first part, first you have to see the anterior and posterior. Anterior part, the first part is related to the quadrate lobe of the liver, that is right side. Normally liver will be presented. As the posterior of the first part of the duodenum is the portal vein, gastroduodenal artery and common bile duct. So posterior, as the first part is of the posterior relation is the portal vein, one artery and one duct. This is the posterior relation of the first part of the duodenum. Coming to superior relations, we will be having the epiploic foramen, which connects the greater sac to the lesser sac. So these two sacs get communicated by the epiploic foramen, which is presented superior to the first part of the duodenum. And inferiorly we have head of the pancreas. Okay. Coming to the second part of the duodenum, we have anterior and posterior. Anteriorly we have right lobe of the liver. Whereas in the first part of the duodenum, anteriorly we have caudate lobe of the liver, and here we have right kidney and right ureter. Second part is the descending part, first part is the superior part. So Posteriorly, we have right kidney and right ureter. Medially, this is the second part. Medially, we have head of the pancreas. Laterally, we have ascending colon. So, as we know, so this is the first part. Second part, third part will be horizontal. This is the ascending part, which is fourth part. In this concavity of the duodenum, pancreas will be presented. So this pancreas, to the first part, inferiorly we have head of the pancreas. For the second part, medially we have head of the pancreas. For the third part, superiorly we have head of the pancreas. And for the fourth part, we have body of the pancreas. Okay. So coming to the third part, as I said, superiorly we have head of the pancreas. Inferiorly we have coils of the jejunum after the third part of the duodenum. Okay. So coming to the anterior and posterior relations, anteriorly we have root of mesentery. The mesentery just arises in the anterior border of the third part of the duodenum. And superior mesenteric vessels. In the third part, the superior mesenteric vessels just crosses over it. Coming to the posterior, IVC and abdominal aorta. These are the two major vessels which is presented behind the third part of the duodenum. So in the third part, superiorly we have head of the pancreas, inferiorly we have coils of jejunum, anteriorly we have root of mesentery. Or otherwise, just remember as the superior mesenteric vessels will be presented anteriorly. And posteriorly we have two main vessels, that is IVC, inferior vena cava, and abdominal aorta. Coming to the fourth part relations, see superiorly, as I said, body of the pancreas will be presented. Inferiorly, root of mesentery. So these are the superior and inferior relations. Coming to the anterior and posterior, anteriorly we have transverse colon and transverse mesocolon. So transverse colon is the organ. The mesentery which is associated with the transverse colon is referred as the transverse mesocolon. So these two are the anterior relations. Coming to the posterior relations, we have left psoas major muscle and inferior mesenteric artery. So posteriorly we have inferior mesenteric vein. Okay, these are the visceral relations of four parts of the duodenum. Coming to the inferior surface of the duodenum, majorly we have first proximal part is the smooth part of the duodenum will be presented. Then later circularis will be presented. And mainly in the second part of the duodenum, we have two openings. One is hepatopancreatic duct open will be there, and the opening of accessory pancreas also pancreas duct, that is accessory ducts of pancreas will be also opening into the second duodenum. So the accessory duct of pancreas will be opening into the minor duodenal papillae, whereas hepatopancreatic duct opens into the major duodenal papillae. Okay, so these are the longitudinal folds. So these are the major features of the duodenum in the interior part of it. So the openings are main, and where it opens in the papilla, that's main. Okay. So coming to the arterial supply of the duodenum, superior pancreatico-duodenal artery, inferior pancreatico-duodenal artery, and supraduodenal artery of Velki, and jejunal branches of the superior mesenteric artery. So these are the main arterial supply to the duodenum. We will see the branches from which it arises. Okay, so first, superior duodenal artery. It is a branch of gastroduodenal artery, as we saw in the abdomen blood supply. Can you able to correlate it? Just see gastroduodenal artery. From the gastroduodenal artery, superior pancreatico-duodenal artery gets arises. But whereas inferior pancreatico-duodenal artery is the first branch of the superior mesenteric artery. Coming to the supraduodenal artery of Velki, it is also a branch of gastroduodenal artery. Jejunal branches is from the superior mesenteric artery, which arises in the left side. Okay, so these are the arterial supply of the duodenum. So this jejunal meninges mainly supplies the fourth part of the duodenum. Okay. Coming to the venous drainage. So according to the arteries, venous drainage also taking place, but it drains into the portal vein, splenic vein, and inferior mesenteric vein. So these three veins are mainly involved in the drainage of the venous drainage of the duodenum. Coming to lymphatic drainage, we have pancreaticoduodenal nodes, lymph nodes, which mainly drains into the celiac node and superior mesenteric nodes. So, in the lymphatic drainage of the duodenum, we have pancreaticoduodenal lymph nodes, which mainly drains into the celiac node and superior mesenteric node. So coming to the nerve supply, we have sympathetic and parasympathetic nerve supply for the duodenum. Coming to the sympathetic, it mainly derived from the T6 and T9 spinal cord. T6 to T9. Whereas parasympathetic is the celiac plexus and superior mesenteric plexus. So parasympathetic is from celiac plexus and superior mesenteric plexus. These are the nerve supply of the duodenum. So coming to the microanatomical structure, which is the microscopic structure of the duodenum. Normally this duodenum is consists of 4 layers, that is mucosa, submucosa, muscularis externa and serosa. In the submucosa, Burness gland will be presented. In the mucosa, villi will be presented, which is a leaf-like shape. Okay. Coming to the clinical aspect. First is the duodenal cancer, duodenal injury and duodenal diverticula. So first coming to the ulcer. Ulcer, as we know, the lining of the duodenum gets injured due to some of the infections or the hypersecretion of HCl, acidic conditions. The lining of the duodenum gets affected. That is referred as the duodenal ulcer. So here you can see the duodenal ulcer, which is due to the excess acidic content from the stomach enters into the duodenum. So mostly the duodenal ulcer will be taking place in the first part of the duodenum. See, this is the first part of the duodenum. This is pylorus of the stomach. So from the stomach, the acidic content enters into the duodenum, which creates the ulcer. So that is known as duodenal ulcer. So coming to the duodenal injury. So normally the third part of the duodenum usually get injured because see, this is the rupture, complete rupture, and this is the perforation taking place in the duodenum and the horizontal rupture, and here the see all the ruptures are taking place in the third part of the duodenum, whereas second part of the duodenum is actually safeguarded by the vertebral glutter, prevertebral glutter, so that the third part of the duodenum is mostly prone to the injuries. So coming to the diverticula, the diverticulum will be congenital or acquired. So this diverticulum, see, in the diverticulum is taking place, it can be, as I said, it can be acquired or it can be congenital, but it should be treated. So these are the clinical aspect of the duodenum. Thank you.